I am the first advanced dental therapist in Minnesota. I spent many years as a dental hygienist, and when I heard about the legislation that was going to be coming into, or that they were looking to come into effect to create a mid-level practitioner, I became very intrigued and very interested in the idea and pursued it. I worked in and around the entire metropolitan area of Minneapolis and St. Paul, worked in dozens of offices where I saw again and again children and adults who were without access to dental care, were consistently denied access to dental care, offices that wouldn't see them for a variety of reasons. Dental decay is 100% preventable, and unfortunately there are many who don't have access to that care or can't access it for a variety of reasons, and they end up in a great deal of pain. I saw over 1,400 patients in 2012. 93% of them were either uninsured on a sliding fee scale here at our office or on public assistance. Children's Dental Services has a great advantage in that we kind of work as a hub and spoke kind of a deal. The headquarters is the hub, but we can spoke out too. We have actually almost 200 locations statewide. I can assess and treat patients, and I do that all in collaboration with my dentist. We talk on the phone, we look at charts together via the internet. You need to be creative and you need to be thinking out of the box, and you certainly need practitioners that are going to be trained to that same level, but in that narrow scope of practice. So the biggest impact I see is that we can help our nonprofit see more children. We once had a mother who brought in a 2-year-old little boy. She had spent all day calling around to different dental offices being told that they wouldn't see her son because both he was only 2 years old and he had public assistance insurance, and we were her very last stop before she was going to just take him into the emergency room. He'd been up all night with a toothache, and as we all know, in the emergency room they would have given him pain medications and antibiotics and been told, please find a dentist. So she was very grateful we would see her son. Unfortunately, he needed to have his front 2 teeth removed. He'd hit them and they'd become infected. About 3 or 4 days later, I see this little kid come cruising around the corner, and he is ear to ear smile with his big gappy smile and comes running down the hall and latches onto my leg. And I still have a hard time telling this story, but all his mom said to me was, all he can remember is you're the lady who took his pain away. So you want to know why I work with children? I get that experience every single day.